Synovial joints allow the body a tremendous range of motion. These movements are produced by the skeletal muscles that contract on different sides of that joint, and in doing so will move the bones that are associated with that synovial joint. Movements are described in reference to three anatomical planes: the transverse plane, the frontal plane, and the sagittal plane. Gliding or non-axial movements occur when two bones slide over one another. However, we don't see a significant change in angle between these two bones during that gliding movement. The other movements we will see changes in angle. The uniaxial joints allow for motion in one of these anatomical planes, so either in the transverse plane, the frontal plane, or the sagittal plane. Meanwhile, biaxial joints will allow for motion in two of those planes, and multi-axial or triaxial joints are capable of producing movement about all three of those anatomical planes. So the table on the left provides a good, however incomplete, summary of the movements that synovial joints are capable of. So we'll look at all of these in addition to some special movements. Gliding movements occur between the carpal bones, that is the wrist bones, or between the bones of the ankle, that are called the tarsal bones. These bones have relatively flat surfaces that promote sliding of two bones across one another, but we don't see that the angle between those two bones changes significantly during these movements. So these are non-axial movements. The axial movements can occur along one or several anatomical planes. And as I mentioned previously, one such plane is the frontal or the coronal plane. Another is the median or sagittal plane. And the third is the transverse plane. So if a joint is capable of producing movement at one of these planes, it is called uniaxial. If the joint is capable of producing movement along any two of these, it's called a biaxial joint. And if movements can occur along all three of these planes, it is a multiaxial or a triaxial joint. Flexion and extension are movements that typically take place within the sagittal plane. So that is, these are uniaxial movements. And they typically involve anterior or posterior movements of the neck, the trunk, or the limbs. Flexion is defined as a decrease in the angle at a joint, while extension is the opposite movement. It is defined as an increase in the angle at a particular joint. For the vertebral column, flexion is an anterior bending of the trunk, so it is flexion of the trunk would require the trunk to be bent anteriorly, while extension is a posterior bending or a straightening from the flexed position. The same would apply to flexion and extension of the neck. Hyperextension of the neck or the trunk will occur when the neck or the trunk are extended beyond anatomical position. Abduction and adduction are motions that occur along the coronal plane and typically involve medial or lateral movements of the limbs, the wrists, the fingers, the toes, or even the thumb. So, and these are also tend to be uniaxial movements because they're occurring along one plane. The term abduction is referring to a structure that's moving away from the midline, so because the term abduct means to take away, while adduction moves them back towards the midline. So think of adduction as adding the limbs back towards the midline. Circumduction is the movement of a limb, either the upper limb or the lower limb, in a circular manner. In this instance, the hip or the shoulder end of that particular limb will remain relatively fixed. Meanwhile, the foot or the hand will describe the circle in the space that it moves. And the resulting motion of the entire limb will kind of approximate or draw a cone in the space in which that limb is moving. The remaining movements that we will discuss are special movements. And the first of these special movements is pronation and supination. And these are special rotational movements of the forearm. In anatomical position, the forearm and the hand are in a supinated position, with the palm facing anteriorly. In this position, the radius and the ulna bones are parallel to one another. If the forearm were to be rotated medially from that anatomical position, so that the palm now faces posteriorly, this would be described as a pronation movement. When the forearm is pronated, the radius and the ulna are crossed over one another, which forms kind of a rough X shape. From this position, a lateral rotation of the forearm would then return the forearm back to its anatomical position and back to a supinated position. Dorsiflexion and plantar flexion are movements that occur at the ankle joint. The lifting the front of the foot so that the top of the foot approaches the shin is referred to as dorsiflexion, and plantar flexion is the opposite movement, which will occur when the top or the superior surface of the foot will move away from the shin, pointing the toes into the ground and lifting the heel. Plantar flexion occurs during the push-off phase of walking or running, and it's the movement that propels us forward when we take a step. Inversion and eversion are movements, very complex movements that occur among several of the plane joints of the tarsal bones in the ankle. It's important to note that these movements do not occur at the ankle joints with the leg, but rather these are movements that are occurring because of the gliding of the tarsal bones within the ankle. Inversion describes a movement in which the sole of the foot is rotated towards the midline. Meanwhile, eversion is the opposite motion, where the sole of the foot is rotated away from the midline. Protraction and retraction describe the anterior or posterior movements of structures like the scapula or the mandible. Protraction describes a gliding, that is a non-angular movement in an anterior direction. Meanwhile, retraction describes a gliding movement in the posterior direction. Elevation and depression are also special movements that occur at both the scapula in the pectoral girdle, as well as the mandible, the bone that makes up the lower jaw. Elevation describes movement in a superior direction. Meanwhile, depression describes movement in an inferior direction. So, for example, the mandible, elevation is an important movement that brings the teeth together, especially when we are chewing food. And depression of the mandible opens the lower jaw for eating, consuming food, or even speaking. The last of the special movements is a movement that occurs with the thumb at the joint between the trapezium, which is one of the carpal bones, and the first metacarpal. And this movement is called opposition. And opposition describes the movement of the thumb that brings the tip of the thumb in contact with the tip of any of the other fingers on the same hand. And this movement is particularly important because it gives us the ability to grasp objects as well as use tools.